Okay, we're going. All right. Hi, everybody. Hello, hello. We're back. Health Shop tonight from Natural Health, and it's going to be kind of interesting, a little different. We have gotten all of our topics ready for the year, and of course, with the coronavirus thing going on, we're dispensing with a lot of that, but we're giving some general information. Tonight's topic was supposed to be on sun health, or is on sun health, and we're going to kind of tie all this together. Again, a little history of ourselves. Natural Health, we've been in the practice now for going on 38 years. Our chiropractic, nutrition, and energy coaching is what we do here. And if anybody has questions about that, they can always call us. We're starting to do free phone consultations now. So if people want to learn more about a natural health perspective or alternative health, which we're going to tell you why that's important as we get into our information here. But can investigate that. You can always give us a call. Happy to talk to this is what we do. So we love talking about stuff like this. And so we'll go ahead and roll right into our topic tonight. And sun health, what we're talking about, and a little CV update or coronavirus update. So we'll go into the first slide. So I think I'm pretty sure it was last year sometime, some Harvard doctor said that, we got to stay out of the sun because it causes cancer. Well, that made the mainstream media and everything. And so everybody got scared of the sun. Well, let's face it. Again, mankind has been in the sun for millions of years, or thousands, or over whatever date you want to use. But anyway, it's not the sun that causes the cancer. It's the poor immune system. And again, that leads us right back to what we're dealing with right now. It's the poor immune system. So the sun is very important for all kinds of things: eye health, skin health. The main thing it helps to do is activate vitamin D. It changes the storage form of vitamin D to the active form of vitamin D, where persons can get, again, use the immune system. So one of the things we see in this climate around here is that during the wintertime, we burn up or use up our stores of vitamin D. And vitamin D, of course, is a fat-soluble vitamin, along with A and E and K. So those are all important too, but these are one everybody knows about. So, and you can't just go to Walmart and buy a whole bottle of vitamin D in an artificial form and expect that to do the same thing as good healthy fats in the diet and the sunlight. I mean, we're led to believe that just because the vitamin D level on your blood work is fine, that's working. Well, no, that's the storage form or the preform. That's not what actually is activated in the body and helps the body to work correctly for brain health, immune system support, heart health, all kinds of things that these vitamins and things do. And so we have to get back to looking at just the basic nutritional needs of the body, which we'll get into shortly. So, but anyway, mankind's been around the sun forever. And everybody knows that when you walk in the sunshine, you feel better. Even your mood is better. There's so many things get better by being around sunshine. Now, of course, we're not saying you got to burn yourself in there. We don't want sunburns. They happen, but it's just a matter of being common sense. And some people's skin is more pale and more sun sensitive than others. So we have to realize that too. But that's why they make hats and long sleeve shirts and things like that. So we also know that in our office that a lot of these suntan lotions cause more problems than they ever stop. The suntan lotions stop the UVB. I think it's UVB. It's one of the A or B. Stop one of those, and but allow the other one to come through, and that's one that burns you. So you can have a burn with suntan lotion on, but it's a deeper burn, causes more problem. And if you're worried about skin cancer, that's the one that causes the skin cancers, the deep ones, the deep burns. So again, you just got to know how this works, and we don't really need suntan lotions. But again, if you sunblock, fine. If you have skin or things like that, or for things you have to watch, we like to use coconut oil. Do just the opposite. We try to bring the sun in and get it into the deep layers of the skin and help to get the body to heal naturally with the oils of the body. Again, vitamin D being an oil-soluble vitamin, all works together. So anyway, very interesting there. The next slide, again, this is an Aborigines person who, I'm sure he doesn't worry about the sun too much. I mean, he's been out in the sun forever, and they don't get skin cancer. Why is that? Because they're not in the sun? Because they sit in the shade all day? No, they have a good immune system. They're not eating junk food all the time. Again, it's back to the immune system, why that's so important there. So that's kind of gives us a good tie-in to our coronavirus update tonight. And again, we know that people are very interested in this and want to kind of know our perspective of this. Another reason we're doing this is kind of getting our perspective. Now, you hear on the news, the mainstream medicine's perspective, you usually hear about the bugs. And we're going to talk a lot about that. We have listened to another one of Dr. Shiva's videos, and we're going to put the link to that in the comment section so you can watch that video yourself. It was done with a news reporter there and asking questions. And so lots of good information here. And so I just pulled off some talking points from that because this all goes right along with our sun health discussion, really. Again, the sun health being immune system support for the body and why it's so important for us. So a big point there is that coronavirus, we're all worried about the coronavirus right now. That's just what's in our head, coronavirus. But what about all the other infectious diseases? How about just the regular flu? We don't even hear about that anymore. Or I noticed the other day too, they're talking about pneumonia. Well, the pneumonia numbers are down. Well, we're going to talk about why here in a little bit. But there's many other reasons that people have problems in the wintertime. Pneumonia, there's all kind of other infections. The bug, again, we're worried about the bug again. So mainstream, I've got that word should be mainstream medicine, not media. Mainstream media is also educated by Big Pharma, but medicine. Medical doctors when they go to medical school, the schools are supported and paid for by Big Pharma. And if you don't believe me, you can check this all out. This is all information that's easily available. And I'm not saying it's bad because the medical people are working with these medications. They need to know about how they work. So it's important on that side. And if you're big into antibiotics and things, you're wanting to work on the bug, which is important. Again, the mainstream medicine has grown up with war, with all the different wars, and a lot of advances in medicine have come from all the knowledge they gained by wars. But on those battlefields, you're treating acute injuries. So they've gotten very, very good at treating acute injuries and acute problems. They just don't do it very well with chronic disease, we're going to talk about. And so that's, again, we'll talk about that in a little bit. We talked about that before. I mean, in one of our videos before, Dr. Chip brought up the CDC's, and that's in some previous videos, CDC's information where 4 out of 10 adults has over
two or more chronic illnesses. 6 out of 10 have at least one chronic illness.
Yeah. So again, that's the report card for mainstream medicine and how they can help chronic disease. Now again, don't get me wrong, they're great with acute disease. I think we just lost. Oh, somebody's trying to call. Okay, never mind. Anyway, it'll go away. So anyway, don't worry about that. Okay. Hope we're back on. Great. So so mainstream medicine does great again with the acute cases, but just not working on the chronic so good. Now, this 99% of fatalities due to underlying chronic disease. This is a study that I got this morning on the line. It's from Dr. McCullough's group. But that the fatalities are due to underlying chronic disease. Most of those people had diabetes, overweight, and they had pneumonia or lung conditions previously already. So, we're hearing these big numbers come out of Italy and how, those terrible. And so there's another reason for this too, which I'm going to talk about in a little bit here. But a lot of this is due to these underlying diseases. Immune systems were already suppressed by what was going on there. So anybody out there now, they're making, you've seen this in other news articles too, but anybody who's diabetic or overweight already has suppressed immune systems. So why are we not handling this? Why, even heart disease? The big killers of us in America, So why are we not handling this? We're just treating it all the time. You're taking a high blood pressure medication. You're taking a statin drug. You're taking a diabetic metformin for diabetes, but you're just suppressing that. You're just managing it. You're managing the disease. We need to change that whole health paradigm. And again, working towards building the immune system. But mainstream medicine doesn't have any ways of doing that, because the ways of doing that is eating correctly, exercising, getting sunlight, getting fresh air, and taking nutritional supplements or whatever your body needs for whatever stressors you're under. And it's very individual. Each body is different. That's another point that even Dr. Shiva makes on this video, is that we are in a day and age of individualized medicine and not this one pill fits all thing. So now, what are the policies of the mainstream medicine is that everybody age 50 and above should be on a statin drug and a blood pressure medication just because. Why not? Well, yeah, that's not treating the underlying causes. That's just treating a symptom or a number. So anyway, we'll go to the next slide and some more points here. So all deaths diagnosed as the coronavirus. We're seeing that these hospital administrators have been given information from the CDC to classify all deaths as a coronavirus death. Now, there's two diagnoses that come from the World Health Organization, and the one is very specific for coronavirus. The other one is very loosey-goosey. If anybody's maybe got a problem, just call it coronavirus. And they're paid more for those diagnosis codes than they are for just dying of pneumonia or dying of heart disease or something. So there's a lot of behind the scenes politics and money going on here. And when you take these numbers like that increases the numerator, and then we know the denominator how many have the coronavirus. If you take a high number of those who are dying with the coronavirus because they cooked and made that number higher, and then you make a low numerator because they don't know how many people have the coronavirus. Well, 50% of the population is going to die from the coronavirus. Well, that's again way off the mark. Right now, we're seeing it's back to 0.1, which is just the regular flu numbers. So again, they're playing games here, and really have to be aware of that when you're making decisions and choices for yourself. So he also makes a point that Dr. Shiva about the locking down everybody is the wrong or an old approach. The social isolation approach like that, where it may be really well or good for people who have weakened immune systems and are really needing to do that. I'm not saying it's all bad, but for everybody to do that, it's bad. Because there's many people in the population who have no risk of even having a problem if they would get the coronavirus. They have no risk. They should be out doing things, working, enjoying life, whatever. But everybody's locked down. So again, it's an old approach that actually makes the problem worse. So many people have patients today who are home. They're getting bored. They're getting, we're not probably reaching desperate yet because we can still pay our bills, but or most people can. But that's going to come, and the more desperate we get, the more depressed your immune system gets, the more emotional problems people have, and there's other problems that come along with that, and that's what's making this worse. So the approach that's being used needs to change, and I'm hearing that by May 1st things should be back to normal-ish. I think they'll have to have some kind of part controls over part of the population. Again, elderly people that know that they have immune suppression problems. Have to be more careful. This is a bug. So the swine flu, the bird flu, all these kind of flus all came around, and again, they either everybody got them, didn't even know about it because they didn't test everybody for the swine flu, or the bird flu, or the AIDS virus. You remember all these things that came through. Well, this one, they really got everything wound up, and it's got to do with the politics involved, and there's a lot of money being floated around, and reasons for this, a lot of control things going on here. So we're back to mainstream medicine. They're bug hunters. I mean, that's what they look at. They blame the bug. So that's important. There has been breakthroughs, and again, we go back to the war scenarios when the mainstream medicine learned a lot of great things about how to treat people and avoid gangrene and all these things, and penicillin came in and all these things, miracle drugs. Again, not taking anything away from that, but they're not meant to be used on a daily basis. And at some time or another, if you use a antibiotic, at some time the immune system has to take over and get the immune system to handle it, whatever it is. So there has been no concentrated effort to get the immune system strengthened up. And why do you think cancer is so rampant? Cancer is definitely a problem with the immune system. The body has cancer cells all the time roaming around in there, and the immune system just handles it if the immune system is working. So that's another thing where you have to look at that side of the coin. The microbiome and the virome. So we have 6 trillion cells in our body. I think 6 trillion cells, but there's 60 trillion bacteria in our gut and 360 trillion viruses in our body at all times. So we're dealing with this all the time. If your immune system is up, and we, as a matter of fact, or as a point of fact, last week's video, we talked about the parts and how the immune system works. So it'd be good to review that. If you missed that one from last week, good to go through there. Also, I'm thinking about if you have any questions too or comments, you can also send that to us here in the comment section, and we'll try to answer those before we end here eventually. These bugs have been around forever. So it's really important for us to start looking at how can we help the immune system, look at that side of the coin and work on that. So this is an interesting book that I have read a long time ago, and it's called Béchamp or Pasteur. And so everybody knows that Louis Pasteur, pretty much everybody knows about him because he was on the scene and they were working on the bugs. He's one of the big vaccine guys, the starter of it. And he had worked with smallpox back in those days when he started working on that. If you read through all these things, and another one called, let's see, I have to look it up on vaccines and things, but Disillusioned Memories, can't remember.
Okay.
Suzanne Humphreys writes another good book, but has a lot of history of this stuff too. And again, I'm not saying it's all bad. I'm just saying it's only half of the solution. Or we need to know the rest of the story. So in Béchamp, he was a great scientist. He wasn't very outgoing, or he wasn't very a marketing type. Where Pasteur, he went and got corporate sponsors, and he worked on this vaccine and started to make vaccines, started to make the money, and so that became a money thing. That's where a lot of this all got started. Béchamp was working on the milieu, the immune system, how the body handles the bugs when it gets in there, and how the body prevents it from even getting in. But of course, there was no big money behind that. And Béchamp was not very outgoing. He didn't really go sell it to anybody. He would just hoping that just scientists would pick it up, and it would be a known fact. But as it worked out, he just kind of slid into, nobody knows who he really is. So it's a really interesting book. It kind of gives you a good history of how all this got rolling. And then now, with the advent of the vaccine laws that take away all the vaccine manufacturers' liability, it's a big moneymaker for the pharmaceutical people. And again, I'm not saying it's all bad. I'm just saying it's not the end all. It's not what we need. As you look at some of Dr. Shiva's videos too, and we explained it somewhat last week in our video, but the vaccines only work on a part, on the adaptive immune system part. And again, the vaccines are also assuming that your immune system is working in the first place. So if you don't have immune system doesn't work, you can't build up the antibodies that the vaccine was meant to help with. So you're still foiled again, and you still got to get that immune system built up. And of course, that's what we do here at Natural Health, is work on that. Anything else there? Making sense? Okay, good. So our last health points here. Guess what? You need a strong immune system. And how do you test for that? How would you know you have a strong immune system? Well, again, that's what we do here at Natural Health. We have a way of doing that with nutrition response testing. And figuring out how much energy the body has for our systems to work correctly. So if you're tired and wore out and depressed and things like that, you're not going to have the energy for the immune system to work. So we have ways of figuring that out, and that's just what we do. And then of course, getting your vitamins A, C, D, zinc, calcium. Those are the big ones that you're even hearing more about. Dr. Shiva even talks about vitamin C as an injection, as a drip, is having great results for people that have coronavirus. But you're not hearing that on the news because vitamin C is very cheap. It has no patent. You can't make big money on it. That's why you're not hearing a lot about it. Now, in our world, I put in here digestion and absorption because I have many people come in here that are taking all kinds of vitamins and they're not getting well. They're not getting there because they're not digesting or not absorbing the nutrition. That's things we check on with our nutrition response testing to figure out what that person needs to help with absorption and digestion. Neural control. Well, the nerves of the body control the immune system and the functions and structures of the neurals, the immune system. So chiropractic adjustments help to release normal nerve energy that the body uses. It uses then the innate intelligence of the body to help the immune system to work correctly and moderate and keep the immune system from overreacting. So I hope people know by now, we've talked about it a few times, that when people have a problem with coronavirus, it's the cytokine storm that comes from an overreactive immune system that's not modulated correctly. So the immune system is weak, it overreacts, and that's what causes the fatalities. It's not actually the virus itself. So it's so important to get this distinction. Even if you don't have the virus, if your body's immune system is not working right, you're still going to have other problems like autoimmune issues, allergies, skin conditions, all kinds of things that go along with a broken immune system. And of course, the big C word. We want to try to get away from that. So chiropractic helps in so many ways there, not just for neck and back pain. Chiropractic is excellent on neck and back pain, but there's so much more that chiropractic works on. And in handling emotions and memories, bad memories, problems in the past, abuse issues, and all kinds of things that are draining the body of energy. And that's why we have Master Eddie is our energy coach here and helps with that too. Because who else is working with it? I mean, if you go to a psychiatrist or whatever, you're going to be on medication again, and you're not helping underlying issues. You're still working on symptom relief. So it's important that we kind of cover. So we have our three-pronged approach to that here at Natural Health. Let's see. Okay.
I'll just put a little bit in there too. Again, with the emotions and memories, that's the fear. Again, all these different things talking about the fatalities and these overblown kind of results that we're getting is giving a lot of people fear. And then fear is feeding the result of, again, with the weakened immune system. And so then it's this snowball effect. And so what we're trying to do is help people understand is that when you're able to build up your immune system, you're strong. Even if you would get the virus, you wouldn't have an issue with it. You're able to, your body's own healing potential and healing capabilities would be able to defend itself.
Right. So we're just trying to get people to not be fearful and give you some basic knowledge as to how your own body's immune system can work. And we're not the only office in the world that can help people with immune systems. There are others out there. We just have the way we do things, and we know it works very well. We have many successful cases and things. So it just the experience over the years has trained us in how to do this stuff and help with this stuff, and that's why we're here at Natural Health. A couple of parting things. We're almost finishing up here. Again, get out in the sunshine. Don't forget to do that. It's sunny today, a little cool. Even if you have to go out in the car, I have patients who will go out and sit in the car, and the car is warm because there's no wind in it, but they get the sunlight from the glass and things. It's kind of like a glass room sort of. You can still get sunshine that way. Really good to do. And also that vitamins, I think a little point here too, that not all vitamins are the same. You can get ascorbic acid from about anywhere, but there's also what we call cataplex C or a C complex nutrition, which helps the immune system a lot better way. Now, ascorbic acid, being an acid, acidifies the body. That helps to change the pH and kills off the bugs. I mean, it's really simple how it works. Ascorbic acid, vitamin C complex, though, works in a lot of different ways. So we know a lot about that here at Natural Health. Happy to explain more about that. And then the other little thing too that we're trying to work with many other of our like-minded doctors that are doing nutrition response testing all across the country and across the world. We're trying to look at changing the healthcare paradigm, which we talk about here. We're trying to get away from this treating the bug thing, treating the symptom thing, and then change that so everybody starts to look at what it takes to be healthy and happy and vibrant, and not just getting by. Right now people, think they have to just get old and fall apart, go to a nursing home for 20 years, and then kick off someday. Well, that's not the way it's supposed to work. You're supposed to be vibrant and healthy, enjoy life, and then when it's time to go, we're going to go. But let's be healthy until that time, and just be vibrant and happy, and not, be able to enjoy life and things. So, thanks, Dr. Shiva there. And then also another great place, the good information, Sawyer G, interesting name. But anyway, greenmedinfo.com. He's kind of a watchdog guy, helping get more information and truthful information on the coronavirus. We're starting to see that a lot of people are picking up on this information and trying to figure out what's going on behind the scenes. So I'm hoping the politicians to get this figured out without other consequences and circumstances. So we'll keep working on that. We'll kind of have updates, I think, every time, every week we do this. We'll have some little updates, things we're hearing here. I look at quite a few different sources of information, and it's a lot of good things. There's a lot of silver lining to this too. If we can hold on and just not be fearful and to start learning about the immune system and how the body heals itself. But we want to change the healthcare paradigm to that one of healing and the natural healing from disease management. That's what we're looking at. So anything else? Otherwise, I think we're done for tonight.
Yeah.
And any questions?
No.
We don't have any questions now, but if you have a question, if you watch this later, we'll have it on YouTube and Brighteon.com eventually. And if you have any questions, always put it in the comment section there. Again, I invite you to watch Dr. Shiva's tapes. He has his own YouTube channel. Again, Eddie's got the link in the comments there to get started. He's already got 3 new ones from yesterday. The one I'm talking about is 2 days old, over 2 million views. And then there's been a couple even since then. So he's trying hard. And again, I like him because he's an engineer. He does not in the medical profession. So the medical people kind of have a bias already. They're already kind of looking at it from a different point of view. They're so far, it's kind of a weird way of looking at it, but they're so far down the rabbit hole that they can't come back out to see a whole view. They're doing it their way, which is great. Again, they do a lot of good for people. They're helping with people that already have the coronavirus, and have symptoms and problems. But let's not get that far. We don't need to get to the point where we're almost at death's door. Let's don't do that. So anyway, different way of looking at things, and just want people to look at it that way. Because again, these viruses and bugs aren't going anywhere. They're going to be here because our body's got lots of them with us all the time. So our immune system has to be working correctly for us to enjoy a vibrant and happy life. So I think that's all we have for tonight. Again, we have our own Facebook channels and things you're watching. Give us a thumbs up, love us and like us, and tell your friends and neighbors, and stay with us. We get the question
real quick. So it's going to be kind of more an introduction question, but it says, how many years have you worked there?
We're 38 years, going on 38 years here now at Natural Health. So a lot of things. I joke around that when I was at U of I in pre-med school, I got one of the first swine flu vaccines, and I thought it was interesting at that time because there was a 2-vaccine program, and they had, I think, more deaths from the vaccine in the first phase, or some people died from that, so they quit the program right in the middle of the program. We didn't have to have the second one. Which, that was before I knew really anything about vaccines. And again, I'm not saying they're all bad. I'm just saying that there's problems with safety and effectiveness there that has to be addressed. But anyway, been around a long time and hope to be around a lot longer. Anything else? And I think we're done for the night. Have a great week, and then next week we'll be talking about leaky gut, which is a really important thing too. A lot to do with the immune system, the leaky gut. And we see almost every patient that comes in here. Of course, they all usually have allergies, but they always have a problem. And leaky gut is a big part of that, and causing a lot of food allergies. So we see a lot of that in here. So anyway, great. Have a good weekend. Thanks, and we'll see you later.
All right. Thanks.